This is Lab Medicine Rounds, a curated podcast for physicians, laboratory professionals, and students. I'm your host, Isabella Dishong, for this special episode. I am currently the president of PathSIG and a fourth-year medical student at the Lake Erie College of Osteopathic Medicine, Bradenton campus. And I recently matched in pathology at the University of Michigan, and I'll be starting in July. This special episode is a collaboration with the Pathology Student Interest Group, week 3 of our Path to Pathology series, focused on residency preparedness. We thought it would be fun to crowdsource some questions from the community about how to prepare for residency. Joining us today to share his perspective on our questions is Dr. Justin Kreuter. He did his anatomic and clinical pathology residency at Dartmouth Hitchcock Medical Center and then did his transfusion medicine fellowship at Mayo Clinic. After fellowship, he became an attending physician at Mayo Clinic and has mentored several residents and fellows over the past 10 years. Thank you for joining us today, Dr. Kreuter.
Hey, thanks so much for letting me be here with you.
Yeah, so thank you and welcome to our residency preparedness session. We've done a lot of events for third and fourth year medical students. So I kind of wanted to do something for us, since most of the PathSIG board is actually incoming PGY1s, and then also, just to actually do something for the residents for once, instead of just them, soon to be residents, instead of just the med students. So thank you so much. And I hope this is useful for you all. I know as soon as I matched, I was kind of like, well, first, where am I going to live? Then onboarding. And then now, how do I actually step into a pathology residency, and what type of mindset should I have for certain questions? And so, all right, so you want to dive into some questions?
All right, I'm ready for you to fire away.
Okay, yeah, I was just looking at this list beforehand and I was like, I don't know if we're gonna make it through all these, but we'll try our best. So
preface this that this is one person's perspective and opinion.
Oh, true, yeah.
And I've been in the game a while, and I do a lot with medical education, and I've mentored a lot of residents in the past and medical students, and fellows, and so I feel like I can have something to share, but I am just one person.
Yeah. All right. So you're not all knowing or anything, right?
Yeah, no, I'm not omniscient. I tell my colleagues that quite frequently.
All right. So the first question on my mind, and kind of what I've been really reflecting on a lot over the past, over fourth year, is so many of us are coming off a very relaxed fourth year. And so how do you recommend we get back into the study flow for residency training?
Talking about like the study flow, if you're talking about how to prep up in this summer period, I think that you definitely need to keep enjoying that summer. So I fully want to give you license to kick back. I was just talking with Izzy in the beginning here about how when I was in your shoes, I spent some time defretting a bass guitar. I also spent some time painting. Feel free to use this downtime for what it is, as downtime, right? So just like an archer might have tension on their bow to shoot, you also need to relax that tension, otherwise your bow is going to go to hell because it's going to get stretched out. So definitely you need to use these periods for what it is. And so what is important to you, if that's connecting with friends, families, significant others, explore hobbies, things like that. I definitely want to give you license for that. If I had my prescription pad up here, I'd give you all like a little cute prescription for enjoying your pre-residency summer. So I think that's really the important thing. In terms of prep coming up, I guess the only one thing I would kind of say, and this is something that is not a huge to-do, but I think that it's what is helpful is that your life is going to get more complicated when you get into residency, and it's just going to be getting progressively more complicated, right? And that's awesome. It kind of follows our growth about what we're able to handle. I mean, I remember being in my sub-I in medicine, and the senior on service was overseeing like 30 patients, and I had like 3, and I'm like, how are you knowing all this stuff? Like, and I remember he just looked at me at the time, was like, you know, when you're in my shoes, you will know it too. And that's so true. Now that I am an attending in transfusion medicine and run this service, like, that is 100% true. And so I guess the only thing I'd throw to put out your radar is, I think it's really helpful to develop some system or a process of keeping track of the to-dos that you need to do, because I think that's something that I was naive about when I was in your shoes, and that's been something that has been an important learning thing for me now, being an attending physician. So I guess I make no money off this, but just a book to throw out there. There's a book called Getting Things Done. Let's see my note. It's by David Allen. I don't have it up to show you guys, but that is just a productivity system, and it's just a paperback book. I think I would, if you have no other kind of productivity system, I would say, hey, that would be something that would be helpful to read and just develop a habit of doing that. And that's going to keep you in good stead for all the other things that we're probably going to talk about in this conversation, and really at the center of being successful in residency.
Cool, thank you. I guess kind of following up on that question then. So I don't speak for everyone, but I'm definitely going to take the summer off. I've just been looking at Airbnbs actually a couple nights ago, but I wanted to ask, so when we do start residency and, we're going to be working all day and then we have to obviously study some at night, how do you recommend that we ease ourselves back into that?
Yeah, the ease yourself back in is an interesting thing. But so here's my second book recommendation, and this one I am also is probably a good one to maybe just read in the summer to prep up, and it's called Make It Stick. It's by Peter Brown. So it's Make It Stick: The Science of Successful Learning. That's another one that just blew my mind, because there is a lot of poor study habits that I have, that I'm sure all of us have. And there is actually a literature about what is using your time valuably. And that, as you can imagine, is your life is going to be more complex by being efficient in your work and efficient in your studying. That's how you're going to have more time to enjoy life and maintain that kind of healthy balance and explore other things that you're interested in life. And so Make It Stick, I guess, just to throw some shout outs for what are some strategies for learning, for kind of adult learning, which is an area of interest of mine, is the big one that is very much backed up by literature is like using flashcards to do retrieval practice, right? So I think there's also like online flashcard services. So using flashcards. So I think as I would be on rotation, I would go and make a habit of creating flashcards for what you learned that day. Right. And I would judge my reading based on that. So doing flashcards, going back to those flashcards, so spaced repetition, and then interleaving, so interlacing different topics. So you might do, surge path rotation, and then you'll do your autopsy rotation. As you start to build up these flashcards, I think, shuffling up in the deck and going through those are the highest evidence base for how you're gonna knock it out of the park with your learning.
Okay, great. So I guess we can all re-upload our Anki decks and get started on those again. I don't know if did you ever hear of those, Dr. Kreuter, Anki decks?
Absolutely. Yeah. I'm hip.
All right. So okay, so how do you recommend finding a mentor in residency training, and kind of, how you're going to decide if it's a good fit, and then what to do if potentially it's not a good fit and you need to find another mentor, and also maybe, without hurting anyone's feelings. So
Yeah. I guess one thing to say is that your in many cases, your residency may automatically like establish one for you when you show up, or they might ask you, are you interested? And they might just generally assign somebody to be your mentor. And that's great. That's to make sure like everybody has somebody to connect with. But I think it's important to also have your eyes open for who who you are connecting with on the faculty. And I think that kind of that who you're connecting with is a really important one, because what's really important in that mentor-mentee relationship is, you got that psychological safety so that you can be honest and have these conversations. It's really important that you also have kind of similar expectations, right? That you guys are speaking the same language in terms of what you're expecting this relationship to be, because sometimes there's a mismatch, and so that goes into the last thing, which I think is really important, which is communication and just talking about that. And so something that we do here at Mayo, which I think is really awesome, and to give a shout out to Carrie Bowler that helped set this up, for our incoming residents, they're asked if they want to have a mentor, and so there are faculty that have volunteered that kind of threw their name into the pot and said, I would love to be a mentor. And with doing that, they have like a contract that we do. And so in other words, I fill out, what am I expecting? They fill out, what are they wanting from me? We both are seeing this and have a conversation about it. And then also it's a time limited thing. It's just meant to go for 6 months. Obviously we can, renew the contract and continue it, but I think that's really healthy because your interests in pathology are going to evolve, and who was probably a fantastic mentor your first year may not be kind of that right kind of main mentor for you later on in your residency experience. And so kind of having these kind of time limited things kind of make it easy. Like there's kind of like a no harm, no foul. Like I don't expect you to always be, us to be going out to lunches and talking about stuff. There's just kind of this natural understanding that people can evolve and have different interests. So I think those are the key things. I think something to highlight is that there is a disconnect. Somebody who is a phenomenal pathologist may not be the best mentor. Maybe they are, and that's awesome. But maybe not. And so I just throw that out there because I think there's a natural, attraction to work with some of these, phenomenal people. It's very clear when you get into departments who are just amazing, dominant pathologists. But, really with a mentor, you're really looking for somebody who's going to really be kind of nurturing your career, which is a different skill than, being a boss behind the scope.
Cool, thank you. I guess we'll kind of change gears a little bit for my next questions, kind of going into more what we're going to be expecting on different rotations in our residency. And obviously every program is unique and different, but just kind of general advice, I think, is what most people are looking for with. So how would you maximize your time on AP rotations? And then how does this approach differ going into CP rotations?
Yeah, that's awesome question. I think so. Starting with the AP, so a third book, just to throw it out. This is not an essential reading at all. This is just if you're nerdy about developing expertise. There's a book by Anders Ericsson called Peak, and in there's this interesting concept of he's talking about really like concert musicians, like phenomenal musicians, and how do they develop their expertise. And there's this concept of there is practice and there is performance. And it's important to appreciate that performance is not practice. What do I mean by this is the fact that kind of doing the show does not count for practice and getting better at your skill. And so why I kind of say this is not to be like cryptic, but to highlight that people are on anatomic pathology rotations, there's a lot of doing, right? There's surgical grossing of specimens, there's a preview of your slides, there's frozen sections that are coming out, there's sign out. You might be going and doing, taking a case to some other colleagues for their opinions. There's a lot of performance that's in there. And I think what I'm highlighting is that residency is an apprenticeship. And so as your goal is to be a phenomenal pathologist, I think that as your time is on anatomic pathology rotations, because there is so much doing on those rotations, I think that you can easily find yourself in a trap of the doing, the performance. And so with the performance, you're going to fall into this habit and not be working on the skill. And so I think I want to really encourage everybody as you're on anatomic pathology rotations, yes, you're going to be doing all these things. Yes, there's kind of performance in that. You do have to cut in these specimens. You do need to preview, sign out. But I think as you go through that, you want to have times where you sort of hit pause and think to yourself, like, wait a minute, what do I need to learn with this specimen? What do I need to think about this? And that's a game that you can play with yourself that I think is really important to becoming a phenomenal pathologist, rather than somebody that just spent time and yeah, you grossed in a lot of specimens, you did a lot of cases. But if you were not kind of reflective about, my learning and working on that, you're really kind of missing a lot of, I guess, the marrow of the experience. I think then to contrast that with clinical pathology, I think that in clinical pathology, the doing, the performance is a lot more nebulous as far as what that is. And I think that's why some people may think that, myself on transfusion medicine, that I spend my days eating bonbons and stuff. Totally not true. But what the doing is not as obvious as it is with like a surgical pathologist. And so, and that's because the nature of what my doing looks different. It's not exactly me doing specific work today. It's the work that I did to set up the SOPs in the laboratory, what's establishing the quality plan, doing vendor qualification. There's also elements of troubleshooting test results that come out, consulting on cases. Some of this will be apparent as the doing to the resident, but there is a lot that happens behind the scenes or doesn't happen on a per day basis that's very important to being a pathologist who is responsible for running a laboratory and running it well. And so for the CP rotations, it's the same advice, is to, there's going to be performance things that you're very explicitly, told that you need to do and work on for that rotation. But you also need to think about your practice and how are you going to be better at it? How can you be performing at or better than your mentor on that rotation? And so what that means is you really have to, because it's not as apparent what that doing is, I think you have to be a little bit more aggressive with talking with your faculty on these rotations. And, what are some challenging cases that have come up for you recently? What's, and how do you bring up a new assay, right? And these are important things because I like to tell the story that when I got the job here in transfusion medicine at Mayo Clinic, which was really my dream job because Mayo lets me do all the education interests that I want to do, when I showed up for the interview, that's when I was told, "Oh, Justin, I'm so glad you applied for this job. it turns out this job also entails that you're going to be a general clinical pathologist for the federal prison system reference laboratory. So in other words, I'm going to be doing chemistry, I'm going to be doing micro as well as transfusion. And in the interview, they told me that and said, how do you feel about that? And, fortunately, I had phenomenal training, and I, without skipping a beat, stuttering or pausing, I said, hey, no sweat, I got that. Same thing happened to one of our residents here that went into, he's a dermatopathologist, and his first job, his first dream job in dermatopathology, he was put in charge of all the transfusion services for the group. And they asked him in his interview, is he comfortable covering transfusion medicine? And of course, because we trained him here, he didn't stutter or skip a beat. He says, sure.
That's
And
awesome.
he's doing great. And
That
so
sounds like my dream job, derm path and transfusion medicine. That's great.
yeah, so that's my kind of gestalt philosophical advice that that I think will set you up for success and really kind of getting the most out of the experience.
How do you recommend getting involved in research and residency? And if you do find a project that you're interested in at the time, how do you basically approach that if they're not really doing a lot of research in that subject at the time, and so on and so forth?
I think approaching research and residency is it's something that I think most of us, many will do, because a lot of times when you're looking for fellowships, a lot of times fellowships will be interested in you having done research projects. And so I think it's also important to understand that I think research projects potentially can be one of the ways, one of the traps that residents can get kind of bogged down with projects, and sort of, I think, start to fail expectations of faculty, and also really run some of their kind of work-life balance down. And so I think that, and I understand that, I was in the same shoes where, you're on a rotation and you're performing really well and somebody wants you to write something up. It's really tempting to, yes, absolutely, and kind of take everything on. And I guess, one thing is, I think, your first 6 months of residency, the first part of residency, that first year, I think, you're getting your sea legs for how does this work, because residency is very different than medical school. I mean, now going forward, very explicitly, you are learning skills that you are going to be using for your professional life, and your patient outcomes are going to depend on your skills, your knowledge, skills, and behaviors. And so you're really starting to cultivate that now. So I think focus on getting your sea legs first. I think then as you go and get projects, I think you'll probably get things offered to you. And when that happens, I think always, my advice to you is always just take a day to think about it. Never answer in the immediate moment, because I think that's where we can get really bogged down. I think taking a night gives you time to maybe even, reach out to your mentor and say, hey, somebody offered me this project, is this the right move for me, or is this going to have a significant opportunity cost, and I'm not going to have that bandwidth for that other project that I really want to do, right? And so I think that time of, hey, give me a little bit of time, to give me a day to think about this, I think everybody respects that, right? I mean, it really shows that you're a thoughtful person, you're a professional. It's not, somebody says jump and you say how high. So I think that's a good way to navigate it. On the flip side, let's say if you're like, hey, nobody's offering me, but I want to reach out and actively find research. I think that's where you're kind of going to your mentor that you're identifying, and reaching out to that person saying, hey, I'm interested in getting research. And that's really helpful because they can connect you with people, right? They kind of generally have a good assessment, or maybe they don't, but they can start getting you more into that area. So for example, I might be mentoring a resident in their first year that, I'm certified AP and CP, but I practice CP transfusion medicine. But if they're interested in doing cardiac fellowship, I'm not really going to be the most savvy for how to prep them up. But I've got colleagues. I'm really good friends with the cardio thoracic pathologists here, and like I can reach out to them and start kind of making introductions so that they can help my mentee find who's active, who's doing interesting things. And I think kind of approach from that way, that's the way to make sure you're getting involved with the project that's going to go somewhere and do something. Rather than, I think if you just kind of pin somebody down directly, they may be in a particular phase where they don't have anything right off the bat, but they may like you and feel compelled to offer you something, but that may not be the best something for you to invest your time in. So I think working it through mentors is the way to go.
Okay, and I have a follow-up question for you on that. So I know you said that in the beginning of residency, we're kind of getting our sea legs and everything. I have heard that we probably shouldn't really get into research until we've taken step 3 or level 3. And I kind of wanted to know what your opinion on that is.
I don't know if that impacts. I think the two in my mind are unrelated. I think
Mhm.
there are others that might have an opinion that sort of links those two, and just kind of I think where that's coming from is the mentality of as a pathology trainee, as you just get more and more out of medical school, I think there's a concern that that clinical medicine gets further and further away. And sort of, I think that helps us, us being residents, pathology residents, sort of, okay, let me, swallow the pill, let me sign up and take care of step 3, pass it and move forward with my life. Rather than, I think where people get into challenging times is if they wait until their 4th year of residency. That's where I think a lot of residents residencies are encouraging people to take it earlier, or earlier in their rotations. But I don't think there's necessarily a true relationship, but it is true. I think, take care of step 3 early and move on in your life.
Yeah, I'm definitely looking forward to taking care of it early, and I'm gonna take step 3 and level 3, so it's gonna be a grueling experience. I can't wait till that's over. Yeah, so I wanted to ask you, when we are starting to study for step 3 and level 3, how do you mentor your residents on, balancing step 3 studying with pathology studying and then also working?
That is something that's not new. And I think that all residency programs kind of have their way and their advice and that pathway. And so I think get into your respective residencies, ask them what's the recommended way. And I think just like in clinical medicine, I always want to just follow the normal algorithm, not be a special case. I think go to your place, figure out how do they do it, how do they set it up, because all places are going to want you to be successful. All places are going to want you to take care of this and get it kind of off of your mind, so you can focus on other things.
So what is the role of having research and having research experiences, whether that be posters, conferences, publications, and then applying to fellowships? I guess it kind of probably potentially varies depending on what fellowship you're applying to, but kind of like a general aspect of, some of the more competitive ones compared to the ones that aren't as competitive.
What's I think worth emphasizing, or important to emphasize here, is the idea that um, you can shift your interests. So I mean, Izzy, you said you're thinking derm path is your way, and so I imagine that being a competitive area, you might be kind of getting right in, and you're probably going to be like, in 6 months, okay, derm path. What's my research? Let's go. And then let's say you come and do a transfusion medicine rotation. You're just like, oh, these transfusion medicine folks, they're just the best, and they're better than that derm path. We're gonna come over that side. You know that that's or vice versa. I'm just playing and having fun here. But what I want to say is that it's not that don't not pursue something just because your research is in a different area, right? Because I think that for most of us at the level that we're performing, these are all transferable skills, right? And I think that research, scientific thinking, participating in the design, the data collection, the data analysis, scientific writing, these are all skills that are general. Just even if you did it in another area. So I think the cake and the icing is it's all consistent in the area and a great story, because obviously then fellowship directors are going to be all excited to kind of hear about your research and things, right? But I think that what you can still highlight, like let's say you did transfusion medicine research, but then you want to do derm path. I think I would, just change what that story is. And you're talking more about, what was the scientific thought you put into the transfusion research that you did, highlighting maybe some of your knowledge about what is some derm path research that you're interested in, right? So you can talk about that. But I think that what fellowship directors really looking at is, do you have these foundational basics, right? Because there are a lot of people that don't, right? I mean, writing is a challenging thing for most of us to do. Some people really struggle with data analysis. Also, a lot of these different study designs can be particularly challenging. And so what you're doing in your residency by doing these research projects is you're really developing your toolbox. And that's what you're going to be using and using for that next step as a fellowship, for a fellowship spot.
See, thank you very much. That definitely answers a lot of my questions with research. And I feel like that was kind of what I experienced with the residency interview circuit as well, because most of my research was in ultrasound and other random things. And no one really cared what my research was in, more of like how the research projects like shaped my experiences in med school and like what I learned. So it's kind of good that that's kind of just transfers over. All right, so let's see. All right, so we were kind of talking about fellowships. So this kind of goes a good transition here. So if we're entering residency with a strong idea of what we want to pursue a fellowship at, what advice would you offer to help secure this fellowship? And then also on the contrary, if you kind of, the world is your oyster, you have no idea what you want to do everything. How do you recommend that people kind of narrow down what they want to do?
Yeah, I think I start off and say both are normal, as you might imagine. So starting off with the person that's laser beam focused, something that I don't even know if I can, it's not possible to overstate this. Please, 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 please don't think of residency as your like pass through, right? And I know that you're not going to consciously do this, but I think that we naturally kind of subconsciously do this, right? I mean, I remember in medical school, I mentally, I started medical school, and for the first 3 years of medical school, I was going to be an anesthesiologist. And so, I think they're just kind of, there's these like preformed ideas in my mind, right? Like when I was on my OB rotation, I'm really like paying attention to, how is OB interacting how does OB anesthesia interacting with this, right? I approached all that from this very specific vantage point, rather than making myself the the kind of strongest, most well-rounded medical student that I could. I was like, okay, if it's physiology or pharmacology, like I'm your guy. Let's do this. And I probably if this is between only us and the audience here, and it's not, maybe the micro wasn't my initial focus, but like I told you, I ran a lab where I was responsible for micro, so I had to do a lot of catching up later in my life and staying on top of that kind of stuff and the new evolutions in the field. And so as you go to residency, if you're even when you're laser focused, right, go and embrace and engage with every single rotation. Because like I say, you never know if you're going to be that person that's going to get offered your dream job and they're going to be like, yeah, we also want you to cover this. Right, which is not necessarily your maybe subspecialty thing, right? You want to feel confident and you say, yeah, I'm the Swiss Army knife, I can do it all. Like, so engage every single rotation that way, right? Because that also is inviting for us as faculty. We really love working with those learners. I think the most brilliant learner I've ever worked with was somebody who was beyond brilliant, and I tried my darndest to get her to do transfusion medicine, and she didn't. And like lo and behold, I find out that she really actually quite very much didn't enjoy the transfusion medicine work.
Oh my
um,
gosh.
but she embraced the rotation. Still to this day, I think she gave the best continuing education I've ever seen in my life. It was honestly epic. And she is a general pathologist in a private group, and she is amazing.
That's awesome.
And so, even if you're hyper laser focused, I think it really makes for the best experience because you're going to be the most prepared. This residency time is a special time in your life, right? This is where you're doing the skill acquisition. Like for me, with all my, responsibilities that I've got of stuff I need to take care of and do, and like it's a bigger challenge for me if I was to, wow, I want to take on some new area of the lab that I haven't done training in or something. Like that's going to be a bigger lift, and may not be a possible lift. And so really use this time, engage with everything. The second thing for if you've got a laser focus is I think that that's where you definitely want to identify a mentor in that area. I think that's obvious, but that's something that you want to do. It doesn't have to be on day one, but right, that's something where you're going to want to reach out to and get to know the faculty. Also, you're going to want to know all the faculty in that area. So I think just kind of reaching out, letting those people know that you're interested in that area, and just start to kind of make the rounds and get FaceTime with these different people, because then people learn to know who you are. Even though you may not be on rotation, if they have interesting cases, they might ping you and say, oh, stop by, I got a really interesting case, which is just, that's icing on the cake for your training experiences. So I think that's the other kind of thing. So flipping it around then to the person that comes in that's just like, I've got no idea, and here I am, residency. And that's where I happen to be. I didn't know what I was going to do in terms of path residency. And so for those of you that are kind of approaching it like that, I think that the same applies. I think certainly embracing every rotation. I think that something to highlight though is spend some thoughtful time, in the evenings after, these days on rotation, and reflect a little bit on what do you think of this experience? Because the interesting thing is, pathology is a wide gambit with very different practices, the kinds of problems that we come up with. I mean, you guys picked obviously the best specialty in the world to do, because we're just like having these awesome puzzles that come up in our lives that we go to solve. But depending on what area that you practice, the nature of the problem, are very, very different. I mean, if you're a little bit of an adrenaline junkie like me, if you like the emergency medicine world, the critical care world, I mean, transfusion medicine might be your jam. But you kind of realize, kind of in the evening, kind of after something, like, hey, like, this is really resonating with me. I think for me, that was my journey of kind of sitting back and reflect in the evening, because I was somebody I loved all my rotations. Like, I really love medical lung. I love I love surge path. I really enjoy medical autopsies. The only area that sort of I had a really hard time with, and I'm sorry because I know some of you out there are really on it, is forensics. So legal autopsy stuff. That was the time where I mentally had the hardest time, honestly, where shout out to my mentors that really helped me through some things. I mean, to see what one human will do to another human, honestly, I would need a fistful of Prozac every morning with my coffee. That was the one. Otherwise, I enjoyed all the rotations, but I think for me, when I was doing transfusion, at the end of the day, I was coming home and feeling like, wow, I really enjoyed working with a team. I really enjoyed. I know that I helped these patients. I saw them. I got to interact with them. And I got to interact with them, and I'm turning this into an advertisement for transfusion medicine. I should stop, but yeah, being mindful. And then I think also with your mentor, again, I think that's the big theme that we're talking about here, is using your mentor to kind of help, kind of as you're going through these feelings and things, and experiences, sharing that with your mentor, and they can really help you kind of sort these things out, help you explore things in deeper ways that just at surface level you're not thinking about, right? Because this is a whole new world. One thing just to riff on for a second, we've been using the word mentor a lot so far, and I guess I just wanted to flush out the concepts of, and this is probably like hot in the business world, the idea that there's mentors, and then there's coaches, and there's like sponsors or something. Like, I mean, there's a couple different words out there, and what I think that means for us as pathologists is that when you're in pathology, there are a lot of allied health staff that work in the pathology department, and they can serve really as coaches for you. They can also serve as really kind of advocates for you. And I think that's really healthy and important to understand, right? So a mentor is somebody who does your line of work. They can help you kind of navigate, not step in the potholes, have the most success you possibly can, right? A coach doesn't necessarily have to be in your area of practice, but they, I think over the years at these academic medical centers, there's a lot of lab staff that have seen who's successful. They also know where the potholes are. They also know where the opportunities are, right? And so if we can talk and have these people want to help us, coach us for where and how we can be successful, I think that's really important. And then for them to be sponsors or really advocating for us, right? Because if lab techs are saying, hey, we should call Izzy on this case, she'd be really interested in this. Quite honestly, one of my areas of interest is acquired coagulopathies and coagulation, and so give all the credit to two people in my life that really helped me. One was a fantastic, brilliant hematologist that she took me under her wings, and she was the one that taught me the dark arts of coagulation. And the lead tech in coag, where I did residency training, she was equally amazing and equally formative for me and my skills. And I had so much fun with her when we'd have some cases. I would kind of, with my naive confidence, would kind of say what I thought something was going to be or something. She'd be like, no. And we had a fun banter, and she really helped me get she improved my education so much for having a sophisticated understanding. So I think it's healthy for us to understand there's mentors, there's coaches, there's people that can advocate. Everybody that works in the lab, they've been doing it for many years. They've seen residents come through. They understand how they can help residents be successful. And we need to realize that they can help us.
Yeah, it takes a village, right? So to make a resident and to run a lab.
It still takes a village. Yeah, totally.
Okay, so I kind of wanted to ask you too about careers. And I know we're kind of running out of time, but how do we navigate early on what career setting we want to practice in, academic versus non-academic, and academic versus private, and private versus reference lab? Because depending on where we all do complete our training at, we're going to have varying levels of experience in each of those categories, or maybe not at all. So I know for me personally, I picture my career being academic in the beginning and then potentially going to private later on, depending on whatever I feel like, I guess, at the time. So I think that is kind of like a common theme of what people want to do. So how do you know that you want to go into private? Are there opportunities usually in residency where you can kind of see that, or do you kind of just tour other labs, or what do you do?
Yeah, that's a great question. My experience has been, and here at Mayo, I think the stats are that about 50% of our graduates go into private practice and 50% go into subspecialized academic
Nice even
practice.
split, yeah.
Yeah, that's why I remember it.
Yeah.
Otherwise, I only remember what I read the night before. So, with that split, I think that, like you and I were talking at the very beginning before we started, that that most residency programs are going to be at these subspecialized practices, and so the experience or exposure to a general pathology practice, in many cases, will come later. A lot of times, a lot of places will have it as elective rotations. So, I know where I trained at Dartmouth, we, as a senior resident, in our kind of late third year or fourth year, we would rotate at the VA where they had a general pathology practice. So I thought that was really, really neat. I'd be doing adequacies for fine needle aspirations, and then I would go deal with a transfusion reaction, and then I would go sit down and sign out some slides. So that was a fun variety. But the issue is that I guess that really kind of comes in kind of a lot later in the training experience, I think, for most places. And so I don't think is a big deal or problem, but I think that it is healthy to start exploring those options earlier. And there are other ways that you can explore what's that life like. How do I, is there a different way that I approach setting myself up for that life? And so I think that's where you can, in talking to your mentors, right? Like, are there graduates of the program here that are in private practice? Hey, can you, these days with Zoom and stuff, it's easy to kind of, do these kind of email introductions and set up, sort of meetings. And then that's the other sort of function of, I think, the conferences that you might get exposed to and go to in residency, is that's another time where you can interact with physicians that are in private practice. Again, with this theme of people, graduates from your program, a lot of programs when they go to, in a couple of the larger conferences out there, might be like USCAP or CAP. A lot of programs will do kind of reunion get-together dinners at these things, and so people that are out in practice will come to those, and those are great time to kind of meet and mingle with these folks and kind of ask some of those questions about what advice they have and
Well,
what's their lived experience.
yeah. So you kind of brought up that kind of brings me into the next question. You brought up some of the organizations that we should be involved in, and then conferences. I wanted to ask, so as PGY1s, what conferences do you recommend us attending? Are there some like really high yield ones where we can get a lot out of it, or as residents? Yeah.
Yeah, I think that most programs, the way you get to these conferences is by presenting an abstract, so doing some research, which we
Mhm.
said, those first 6 months, you're really getting your sea legs. So I think for a lot of places that first year, you may not go to a conference that year, because I think a lot of them, in just terms of timing, it doesn't work so well. But as you go through that first year, in the latter half, as you pick up a project, then you can work on something that will get submitted in the second year, where then you'll go and attend. And I think that the general kind of broad ones I think about for pathology, we mentioned USCAP. I think about as really a academic, really surgical pathology conference. So unfortunately for me, that's where I think a lot of places people get together for those reunions. But as a transfusion medicine person, we don't have transfusion at USCAP, so I never go to that meeting anymore. But that's hugely popular and important. So if you're wanting to go into a fellowship in one of the surgical pathology specialties, I think that's the place to be kind of front row center. I think CAP is more of kind of a broad experience. There's anatomic and clinical pathology, and because of that, there's a lot more private practice pathologists that attend that. Of course, academic as well. Usually they'll be attending because they may be involved in doing a lot of presentations. But a lot of private practice folks will attend at CAP. And I think it's the thing to think about for first year to kind of put on your radar, because sometimes it takes time to do this. But are you interested in joining a committee at these with these organizations? A lot of places will have like junior members for committees. And in that first year, that's where you can kind of talk to your mentor and you can kind of get plugged in if you want to make that kind of application. I was talking to one of our residents today where she put in an application in her first year, and then now in her second year she's on one of these committees as a junior member, and that's another way that she is now for sure going to the conference. Also for sure, she's getting involved and getting that experience in kind of that medical leadership role that's out there, right? Which is another way to kind of give back and participate in the community.
Yeah, that, and as long as conferences are still in person, we'll see how things go. It's a great way to travel too. I saw on the list that CAP and USCAP are both in New Orleans this year, and so that's really exciting. But someone asked in the chat, and I just want to ask because it's related to conferences. So, and I don't know how to say your name, so I'm sorry. I think it's Shant. Shant asked, any thoughts on ASCP? Sorry if that was already covered.
Oh yeah, ASCP is another great one. Thanks for calling that out. So ASCP is another one that many residents can get involved in. Also has a rich committee structure, and so yeah, those are the three to probably think about as kind of the core of pathology. So ASCP, American Society of Clinical Pathology; CAP, the College of American Pathologists; and then USCAP, the United States. So college is CAP.
College of American Pathologists, maybe.
Bingo. Yeah. It's obvious I don't go to that meeting anymore as a transfusion guy, but yes. And just to highlight, those are those kinds of differences, you know, where you go and which one. But I think all three give you great opportunities, great connections, great exposure.
All right, great. So we'll kind of wrap this up with one last question, just because I feel like we wouldn't be well balanced unless I also ask this question, and that's, how do you recommend maintaining work-life balance? I know we kind of talked about this a little bit already, but I guess kind of to specify the question a little bit more. So I feel like inevitably we're all going to experience burnout at some point in residency. I think that's just kind of the name of the game. So what are some ways you recommend, like, recognizing this burnout, and then kind of, I know everyone's different, but steps that you take and that you have recommended people take to kind of get back into your groove again?
Great question. I think that the most important thing, I think, for us is so what we've done so far for talking, so try to mitigate our risk as much as possible, is to be very intentional about what projects we take on, right? And I think another one that's really important for mitigating it is talking, and talking often, talking early, right? That's where, if we can let mentors know, hey, I'm starting to really kind of struggle here, they can start to help connect you with what sorts of tools and resources, thoughts they have. How can you still get the work done, be successful in your residency, but get more time. And then I think the other thing is to be thoughtful about what do you do with that downtime, right? Because I can spend my downtime doing things that are not fulfilling for me. So, and I think before I say anything more on that, I should say that, as you pointed out, Izzy, like, we all have different things for what works for us, what we find restorative. So I'm kind of extroverted, so I mean, going out to a social event can recharge me. My wife is introverted and it does exactly the opposite. So I think that it's really important to also be, what are you using in your downtime that's going to recharge you?
Mhm.
I think the thing that I do a lot of journaling, and I think maybe some people are like, journaling, like that is a great way to kind of you can think of it as capturing your learning, if you're in training, right? Or for me, I'm a lifelong learner, so you know uh, it's a great way to kind of capture your learning. How are you feeling? Because sometimes we sort of, like you're saying, you lose track and all of a sudden you're just like, man, I'm toasted, I'm no good, right? That's not being the professional that we want to be, right? I mean, somebody is a professional because they can get up and play despite the circumstances, right? They're able to perform. All right. But I mean, and so what does that mean is maybe it's making sure we get enough rest, we're getting our downtime, we can do that performance. And I think that, like you're saying, with this residency, this is this formative time where you are taking on this new important professional identity. And how do I behave as a professional here? How can I show up as a professional? This is how we do it, I think, is this kind of reflecting. I like to journal and write about, how the day went, or in the morning, what am I going to be really like focus on today getting done? This is the way that I kind of catch myself when I'm starting to feel off. I've got several colleagues here that I kind of talk to and kind of have as my, informal mentors that help keep me balanced. And then in me personally, like, I like pen paling and painting and playing music, jamming with friends. So these are the things that restore me and kind of keep me good, to where I feel like I'm getting my creative outlets and I can show up and perform at a high level every day. And so I think if you're journaling, even if you have never done it. I think if you try it, give it a shot. It's a way that you can kind of capture and realize, because it makes it explicit, like how you're feeling. It pulls it out on the page, and you look at it, wow, I didn't know I felt that way. It can really kind of help, make sure that, you're realizing, what do you find restorative? What do you find that's really kind of killing you out? And I think in this point where you're trying to figure out, how can I show up as a professional, this is important things for to know about yourself, so that you can always show up at a high level and perform.
Great, thank you. So we all need to figure out what our hobbies are before we start residency. And if you don't have any hobbies, get some. And yeah. So I stand corrected, by the way, with the USCAP, or is it USCAP or is it USCAP? How do people say it? I don't know. But it is United States and Canadian Academy of Pathology. So I was corrected in the chat. So I just wanted to clear that. So I'm sorry, Canada, we love you. We just forgot. We've been rounding with Dr. Justin Kreuter today. Thank you for taking the time to discuss our questions about preparing for a successful residency experience. To all our listeners, thank you for joining us today. We invite you to share your thoughts and suggestions via email. Please direct any suggestions to mcleducation@mayo.edu and reference this podcast. If you have enjoyed Lab Medicine Rounds podcast, please subscribe. Until our next rounds together, we encourage you to continue to connect lab medicine and the clinical practice through insightful conversations.